Hello everyone, this is Dr. Shishma Sarilla, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss a very important topic, running topic in PCOS, which is relation of PCOS to insulin, or we can also call it as PCOS and insulin resistance and its relation to type 2 diabetes. So let's dive into the topic to know how this PCOS is actually causing insulin resistance and how this insulin resistance on a longer term can turn into type 2 diabetes. As we all know that PCOS is not just a disease which is related to the female reproductive system. It is an endocrine disorder which causes or has effects all over the body. So let's look in to the topic more to know, So let's dive into the topic to know more about it. So what is PCOS? What is the connection between PCOS and insulin? As we know that PCOS means Polycystic Ovarian Syndrome. By the word syndrome, we understand that it has action on multiple organs in the body. Right? In the same manner, it has action on insulin as well. So how does it act on insulin and how is it causing insulin resistance? We will be knowing, but you have to know the important point is that PCOD is different from PCOS. Majority cases of PCOD are not having any sort of insulin resistance, or may have insulin resistance only when there is improper lifestyle. Okay, but PCOS is related completely to insulin resistance and to type 2 diabetes. Here we are talking about PCOS, which is a full full body endocrinal disorder. So what is insulin resistance? You might be seeing a lot of YouTube content, or you might be seeing a lot of Instagram reels, and even many people talking about insulin resistance. Many people know that insulin is related to type 2 diabetes, or they know that this word means type 2 diabetes, or at least diabetes as such. But many people do not know what is insulin resistance. So let me tell you in a very crisp manner what is insulin, what is the use of insulin in maintaining or monitoring the blood glucose level, and also how insulin is related to PCOS and what is insulin resistance. Let me take me as an example. For example, I am feeling giddy or I am feeling very hungry, and right now the only food that I have is chocolate. So what do? I unwrap the chocolate and then I eat chocolate. After eating chocolate, before eating chocolate, my blood glucose level was, let us say, 80. And after eating chocolate and after 35 to 40 minutes, now my blood glucose level is 120. Okay, it was before 80, now it's 120, right? So my organs need this blood glucose level to function. The brain needs glucose, liver needs glucose, muscle needs glucose. Every organ in the body to run normally needs glucose. So because there is a raise in glucose, you might be thinking that organs will directly take the glucose from the blood and then they will consume it and we will gain energy or we will run today. But the thing is that the blood glucose level after it is being raised is not directly consumed by organs. It needs a mediator. That mediator is called as insulin. Now let us see how this runs. For example, I'm taking a chocolate. The chocolate is digested by my GIT tract, and my GIT tract, from the GIT tract through the blood vessels, it is going into the blood. Now the glucose is there inside the blood. It is available to the organs to consume, but they cannot consume. Why? Because they are not directly having receptors to allow blood glucose level into the cells. Okay, so what happens? The brain, what it does is it signals the pancreas, telling it, see, the blood glucose level has risen from 80 to 120, so you have to release insulin. Insulin is a hormone. So what happens? Insulin is released. What does this insulin do? Insulin will act on the receptors. For example, this is the cell in, for example, muscle. Okay, so it has a receptor on its surface, and then the insulin is released by the pancreas into the blood. So the blood has glucose, the blood has insulin right now. So what happens whenever the blood is going to each and every cell through capillaries and through diffusion process, the insulin comes in contact with the receptor and it binds to the receptor. And when it binds to the receptor, a gate is opened in the cell for the glucose to go inside. And this glucose is converted into ATP for our body to use. Okay, you understood how this insulin works, right? And how the pancreas works. So what happens in PCOS is that we will know by what reason it is happening, but I'm just telling you what happens. What happens because of the various reasons in PCOS is that there is problem in the receptor. Okay, so receptor is shaped like this. Okay, and insulin is shaped like this. Okay, this is a triangle, this is inverted triangle. Okay, so what happens is that sometimes because of the PCOS problem, this triangle which is supposed to be a triangle is converted into a circle. Okay, or it is converted into a triangle with a little bit of tail. Okay, so the insulin, when it comes in contact with the circle, it is not allowing the gate to open, so the blood glucose level, the glucose is not going into the cell, or the insulin is binding here and then it is a mismatch. That is why the blood glucose is not entering into the cell. So PCOS changes these receptors, and what the body feels is that, see, we have released insulin, which is usually, like, suppose we say 5 units of insulin are being raised. The 5 units of insulin are being released. Because there is change in receptors, the insulin is not binding to them. So what happens if it is not binding to them? The blood glucose level is sustainedly the same. Okay, so what the brain will feel, see, the blood glucose level is really high, we have to get it into the cells, or we have to store it in some form of thing. So what we have to do? We have to tell the pancreas to secrete more amount of insulin. So the 5 units of insulin are secreted, and then it is not working, again 10 units are secreted. Even that is not working, sometimes 20 units are secreted. It doesn't matter how much insulin is secreted because the receptor is different right now, right? So insulin is there in the body, hyperinsulinemia is there in the body, the blood glucose there in the body, but the receptor has changed, so there is insulin is there, but it is being resisted. That is called as insulin resistance. And if this happens for a longer period of time, it also depends upon the obesity, the lifestyle that you are leading. This hyperinsulinemia, this insulin resistance, what is happening, can turn into type 2 diabetes. What is type 2 diabetes? The pancreas secretes lot of insulin every time you're eating. It over secretes insulin. It secretes so much that it is exhausted, and then it will not secrete insulin at all, or very little insulin for the blood glucose level that you're consuming, right? So that is the problem happening, or that is how you get type 2 diabetes. Okay, so you have understood what is insulin, or what how it works, and what do you mean by insulin resistance, right? If you're someone who's suffering from PCOS, insulin resistance, type 2 diabetes, or any other female related problems, you can contact Fidicus Homeopathy. Here we have two kinds of consultation options. One is the online consultation option, and the second one is the offline consultation option. If you're someone who's staying nearby us, you can contact us offline. If you're staying far from us, you can contact us online, either through audio consultation or through video consultation. And after consultation and the investigations, verification, especially to the online clients, the medicines will be sent to your doorstep. If you're staying in India, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. If you're staying elsewhere across the globe, it can take 48 business days for our medicines to reach your doorstep. If you want to get in touch with us, or contact us, or take a doctor consultation, or if you have any sort of queries, we are here to help you out. You can contact us on this number, messages, or WhatsApp us. And if you want to know more about Fidicus Homeopathy, please do check our website www.fidicus.com. We have discussed how homeopathy is the best choice of medicine for treating PCOS or these lifestyle disorders. As such, so why should you choose Fidicus Homeopathy? Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. First and foremost thing, and very important, is that we have already having good success rate in treating PCOS, PCOD, female related problems. And apart from that, the transparent treatment, that is, there is no gray area between the patient and the doctor. We will be clearly stating you about your prognosis. And the personal care here at Fidicus is top notch. Here we will be answering all of your queries, and also if there is any sort of myths that you have continuously put into your head, we will be busting all of your myths with the facts, and we have qualified doctors here. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.